Hello everyone. So today we are going to see about the part 2 of temporomandibular joint. So first we are going to see about the articular disc. So this is the articular disc. So this articular disc divides a joint cavity into upper and lower compartment. So it is called as complex joint. So this is the articular disc. So the cavity which is present above the articular disc is known as upper compartment. The cavity which is below the articular disc is known as lower compartment. So this compartment is named as upper compartment is named as menisco-temporal compartment and the lower compartment is known as menisco-mandibular compartment. As we see, the above we have the temporal bone and below we have the mandibular bone. So the upper compartment is known as menisco-temporal compartment and the lower compartment is known as menisco-mandibular compartment. So this is the articular disc. So we have the upper compartment and lower compartment. This upper compartment is mainly responsible for the gliding movement, and the lower compartment is responsible for both gliding and rotating movement, maximum of rotatory movement. Now look at this. So this is the articular disc. So upper compartment, it is doing the gliding movement and the lower compartment both gliding and rotatory movement. One more time, this is the gliding movement and this is the rotatory movement. So this articular disc has 5 parts. So it has anterior extension, anterior thick band, intermediate zone, and posterior thick band and posterior bilamellar zone. So this part is known as anterior extension, and this is known as anterior thick band, and this is known as intermediate zone, and this part is known as posterior band, and this layer is known as posterior lamellar zone. So this posterior bilamellar zone divides into upper and lower lamellar. So in between them, there will be presence of venous plexus in between the upper and lower lamella. So this upper lamella gets attached to the squamotympanic fissure or suture. So the lower lamella gets attached to the posterior surface of the neck of the mandible. So this is anterior extension, anterior thick band, this is thin intermediate zone, and this is posterior thick band, and this is bilamellar zone. This is upper lamella and this is lower lamella. In between them, we have the venous plexus. So how the articular disc works? So it is a degenerated part of the lateral pterygoid muscle. So articular disc is formed by the degenerated part of the lateral pterygoid muscle. What is the function of the articular disc? So it helps to stabilize the joint and it prevents the friction between the two joints. It also acts as a cushion.